Well, hello. My name is Emma Missling. I am a second year epidemiology MPH student here at the University of Minnesota within the lovely School of Public Health. I am presenting a poster here on my actual master's thesis project, which is outlining or detailing the school nursing workforce in the state of Minnesota. Why I wanted to do this is because the statute that outlines how school nurses are hired is based on an enrollment threshold of 1,000 students or more. So technically speaking, based on the statute, small districts are not required to have an LSN, a licensed school nurse on staff. Overall, smaller districts and districts in rural areas are less likely to have a licensed school nurse or a registered nurse that is not also a licensed school nurse on top of that.
Hi, my name is Adora. I'm currently a second year graduate student. At my poster for Research Day is actually my thesis that I'm doing for my ILE class. I looked at the association between diabetes and cancer with a specific focus on breast cancer. And after doing my results, I found out that those with diabetes had a slightly higher odds of cancer, and those with prediabetes had a higher risk of having concurrent breast cancer and cancer in the research study.
So my name is Nicole. I worked with the Minnesota Department of Health and the Mobile Health Initiative here at the U this summer to develop newcomer priority health evaluation screening guidelines. The goal is basically that a lot of migrants have the same healthcare needs as refugees, but they don't have the same benefits. Refugees get coverage from the state to help them pay for things and attain housing, and a lot of migrants don't have that. So traditionally, doctors approach their healthcare the same way, but they have different needs because they don't have the finances to be able to pay for it or get their housing, clothing, transportation, things like that. So the goal is to just find a way to make the healthcare process less daunting for them, to focus on their outside needs rather than just screening for everything, and prioritize what we're screening for and the cost of things.
Hello everyone, my name is Rahama Before. I'm a second year MPH student in the epidemiology program, and today I'm presenting my research about association between long COVID and sleep duration. Technically, we are living in a post-COVID-19 era, so we have to do a lot of research about COVID-19. In our results, we found that people who have long COVID, they are experiencing or have higher chance to have less sleep hours compared to people with no long COVID.